So we are preparing the morning's vaccines. We typically do about 1,500 up to 2,000 doses a day. Those all have to be put in syringes.
It's 8 a.m. and staffers at Kedren Community Health Center in Los Angeles are preparing for what's sure to be a busy day.
So we already have 2 nursing homes that are ready for pickup.
Dr. Jerry Abraham is director of Kedren's vaccine program. His team is made up of doctors, nurses, volunteers, and medical students.
It feels absolutely incredible just to be able to be a part of the vaccine efforts here in the community, doing what I came to medical school for.
On this day, Dodger Stadium and other vaccination sites run by the city of L.A. are temporarily closing after running out of supplies. That's putting more pressure on Kedren.
With Dodger Stadium and all the major pods closing down because of shortages, what we could end up getting is the influx of those people.
On it. But also influx of any doses that they don't know what to do with right this second, because they may have a few hundreds.
Exactly.
The city councilman representing this area praised the work being done at Kedren and other neighborhood vaccination sites.
It's important that we have community-based locations. As I said, the facilities at Dodger Stadium or at the Forum are not like being able to go to your own neighborhood and around the corner.
With the vaccine in short supply, Kedren has a system in place to get leftover doses from nursing homes and other facilities.
And when we've got expiring doses, we send a fleet of vehicles, and they go pick them up, they bring them here, and Dr. Rodriguez and his team draw them up, and we get them out.
The team tells us not a single drop of the vaccine can go to waste.
There's other groups that when they get to the bottom of the vial, they just throw it out. But we squeeze every last drop and make sure that every amount of good vaccine that we're given goes out to the community.
Now, there are a couple of lines of people waiting for vaccines. On this side over here, you have the folks with appointments. But just a few feet away is the people waiting in the standby line. Now, those are the folks hoping to get some of those extra doses of vaccine. And on this day, the people who arrived early, they were let inside. A clinic administrator grabs people out of the standby line who meet state requirements that those up for vaccinations right now be over 65 or frontline healthcare workers.
I think it's very important to get vaccinated, with so much going on and so many people dying from it. I think it's very important.
Those lucky enough to get shots are grateful. Now, did you have an appointment or did you just walk in?
Just walk in. Yeah, just walk in, fill out the application, have a seat, call your name, then they give you the vaccination. Then they have you wait 15 to 20 minutes to see if you have any side effects from it before you leave, and that's it.
In a county of over 10 million people, Dr. Abraham says L.A. desperately needs more of the vaccine.
Vaccines need to go to the zip codes where there is the most COVID, and that's where we are here in South L.A.
It's a plea he hopes makes it to the politicians in Washington. Reporting from South Los Angeles, I'm Anita Bennett for BNC.
BNC was one of only 2 media outlets given access inside the clinic's vaccine operation. The other was the Los Angeles Times.